To cure COVID-19 is currently being tested in Israel. It was clinically tested on 30 patients suffering from the disease and reportedly cured 29 of those 30 people. All 29 had improved medical conditions within 2 to 3 days. The drug works by stopping the body's reaction to COVID-19, in which the immune system destroys healthy cells. Joining us now to discuss is CEO of GeoVax, David Dodd. David, what's your take on this?
I think it's great news. It's a good start. This is similar to some of the drugs that we see in use for influenza, and it's a very high efficacy rate. And my guess is that the upcoming trials will pretty much show that it's safe also, and they'll learn about how to take it. That's why they're doing some of the trials with food, without, et cetera. But I think this is great. People who contract the virus need to have a therapy that can keep them out of having to go to the hospital and certainly towards mortality.
See, now, a lot of folks are going to hear about this and think, oh, well, then why do I need to get the vaccine? I can just wait, and if I get COVID, they now have a cure for it.
Well, you need to have both tools out there, just like with most infectious diseases. People who are at risk and could contract it, they may not be able to receive a therapeutic in time to be able to take care of them as it should. So people need to have a vaccine to not only prevent it, but also to lessen the effects if they do contract it. And then if they do have it, they need to have a therapy that will enable them to continue and not to go forward with worse morbidity or, worse of all, certainly mortality.
There are stories that float around out there that try to scare you from the virus, rightly or wrongly, based on facts or made up stories. We're not sure, but I wanted to get your opinion on them. We were just talking a moment ago. There are things going out that the mRNA that is used, the way you deliver the vaccines for both Pfizer and Moderna, and correct me anywhere in here if you want to, that they could do long-term damage to you in some ways.
Well, that's all pure speculation because, first of all, we don't know. There's never been an mRNA vaccine out there, so we have no idea. But that doesn't mean to be afraid of it. But yes, over time, we will see if there are any longer-term side effects. I don't think there are, given the millions of people who've been vaccinated so far. It would be very rare to suddenly see something crop up. But this is a challenge when you introduce a new technology, is you need to be concerned about not just immediate, but also long-term consequences. So we'll learn over time. There's nothing else we can do if we're going to administer a brand new technology that we didn't rush it to market, but we accelerated it to market. And there still are a lot of questions out there, as you raise, and we'll just have to learn over time. That's why technologies such as GeoVax, where there are already products on the market, it's been around since the 1960s. It's exquisitely safe. That's where they can come in, and for certain populations, that's where we're going to play a role, we believe.
Mm-hmm. David, what about these reports about the Biden administration wanting to lift the patent on these vaccines so that it can be sent to other countries that aren't quite as wealthy as the United States? How do you feel about that?
It's very concerning. It's not a good idea. Yesterday, the head of the Industry Association, obviously they're biased because it's made up of memberships, but I think they are very objective in what they do towards public health. They sent a letter to President Biden and urging him to reconsider that. We don't want to halt innovation. We don't want to halt innovation in the enthusiasm that people get on wanting to advance something because they may end up determining if their intellectual property they develop and their know-how is going to be just given to others. I don't think it's necessary. I think companies the industry has shown more than ever before in this pandemic the ability to cooperate and help public health, and if necessary to do things at next to no profit. And that's the commitment we've all. I don't know of a company that has not made that commitment and would not follow through. So I don't think it's necessary. I think it's a bad idea. Mm-hmm. It sets a very bad and very concerning precedent.
Okay. Well, David Dodd, thank you as always for joining us.
Thank you.
And coming up,